What's going on, Decatur? This is Dr. Waldeck with Health Source Chiropractic. Today, I want to let you guys know about a service we provide. We treat motor vehicle accidents. I'm not sure if you're aware that chiropractors are great with car accidents that are subfracture type injuries, meaning you got banged up, maybe bruised up, a little sore in your neck, low back headaches, but no fractures in the bones. They typically come to clinics like ours. This is a referral for a patient that was just in a car accident from a local orthopedic group. The diagnosis is sprain strain of the neck, the rotator cuff, and mid-back. The treatments prescribed for this patient are 2 to 3 times a week for 6 to 8 weeks. Hot and cold packs, electrical muscle stimulation, ultrasound, active passive range of motion rehab, and strengthening rehab exercises. We do everything on this here. And one of the other things that we're going to do for this patient is get our own set of images, because sometimes some things are overlooked or just not assessed. This is a side view of a patient's neck. Okay, she's 8 years old. A couple of alignment issues, not too bad. Really, it doesn't look too bad here, but we take another series here. We did a flexion extension series. So this is her with her chin bent all the way forward. We can see on this one, there's just a little step forward, step back. Not too bad, but on the next shot, we see some translation in this joint, meaning there's a little bit of sprain strain in her neck. This is exactly what a whiplash looks like. This is really typical presentation. So her chin is elevated as far back as it can, and we see these joints step off each other. So these ligaments in her neck were sprained and strained, and they needed rehab exercises for her neck. She was having dizziness, headaches almost every single day. She couldn't focus in school. She's asymptomatic now. We got her straightened back up, but I just wanted to show you these are some of the things that we're looking for in this office. And I also want to show you sometimes we'll have to refer out for an MRI. Okay, so if we have radiating symptoms that aren't responding as fast as we'd anticipate, sometimes there's something else going on. So in this patient, they're facing in this direction here. Here's the back of the head, the jaw starting right here. This is the brain stem coming down through here, and here's the spinal cord. And in this segment here, between 5 and 6, there's a posterior disc bulge. And it's putting pressure on the spinal cord here, and actually the nerves that will exit on the right and left hand. So he was having radiation into his hands. This is a different patient, but just an example of things that we're looking for when we're assessing patients following motor vehicle accident. So just keep us in mind if you guys have any questions or you've had an accident in the past and want to get checked out. Phone number is 822-1010. You can post your comments, questions down below. And I appreciate you guys so much for watching. It's great to see your beautiful faces again. And thank you so much. We'll see you guys in the next video.